Hello and welcome to the Society of Anesthesia and Sleep Medicine podcast. I'm Cara Dupuis. I practice pulmonary and sleep medicine at the Mayo Clinic in Rochester. And today we're going to be discussing dual credentialing in anesthesia and sleep medicine. And I have some very special guests with me.
Hi there, I'm Mandeep Singh. I'm an anesthesiologist and sleep physician based in Toronto. Fortunate enough to be associated with University of Toronto and be working with an amazing group at the Department of Anesthesia and Pain Medicine at Toronto Western Hospital, University Health Network, and at Women's College Hospital. And thank you so much, Kara, for having me here.
Hi, I'm Ameya. I'm currently an advanced clinical practice fellow at the University of Toronto in the Department of Anesthesia and Pain Management as well, at the University Health Network and Women's College Hospital. I just completed a sleep and anesthesia combined fellowship under the guidance of Mandeep Singh, and sleep is my area of interest for my future practice. So thank you so much for having me as well.
Hi, everybody. I'm happy to be here. My name is Sarah McConville. I am a physician, anesthesiologist, and I subspecialize in sleep medicine. I completed my residency in anesthesia at the University of Utah in Salt Lake City. And it was during my residency that I learned about the opportunity to do sleep medicine and to formally train in the field of sleep medicine. And so I explored some interest. And then I had a strong interest. I applied for a fellowship and also completed my sleep medicine fellowship through the University of Utah, which included training at Intermountain Healthcare. I finished my residency in 2016 and my fellowship in 2017, and then completed board certification for both of my specialty and subspecialty shortly thereafter. Currently, I'm in Portland, Oregon at OHSU, or Oregon Health and Science University, where I practice both anesthesia and sleep medicine. I especially enjoy seeing patients referred by our surgeons or our proceduralists, in particular cardiologists, because I like being able to talk to patients about the intersection of sleep disordered breathing and surgery and anesthesia.
Great. Thank you all for joining me today. So I've asked you here to talk about dual credentialing in sleep and anesthesia. And I know you published a paper a few years ago on that topic. And so if that's okay, I would first of all like to ask you a little bit about that paper. So first of all, can we start by talking a little bit about the background of the study? What made you want to do this study? What was the inspiration behind it?
That's a great question. First, I think they deserve so much credit for all the work that was put into that and, getting the publication sort of successfully accepted in a journal for everyone to be able to see. We were really interested in exploring really what people know and don't know about sleep medicine as a subspecialty for anesthesiologists. I think those of us here on this podcast and the others out there who practice both specialties see it as such a unique and fun and sort of well-poised combination of practices that really has a lot of value to offer and a lot of relevance for our patients and for our practices and the centers where we work. But we realize that a lot of folks have no idea that you can train in sleep medicine as an anesthesiologist. And so we wanted to, dive deeper into that and see, what do people know? What do they not know? What might be their interests and what might be their concerns? Because we hope that if we can help people understand more about this opportunity, that it might draw more anesthesiologists into the field of sleep medicine.
Thanks, Kara. I've been fortunate at our center to be present where a lot of work in sleep and anesthesia started. So way back with Francis Chung, who actually took and designed the Stop Bank questionnaire, which everybody knows now. So we were fortunate enough and to be inspired by her and also inspired by other mentors who encouraged me to take up this interest between the two fields of anesthesiology and sleep medicine. And if you think about it, it's quite natural what these two sciences address, and there's a lot of scope for research innovation, but there's also career development. So that's how it started. And similarly, there was Sarah McConville, who's also joining here for this podcast, who also got interested. So both of us were kind of carving this niche at our institutions. And we got together and we said, hey, you know what? We need to explore this interest in anesthesiology trainees and how we can actually develop this further and take it forward. So that was one part of our objective. The other objective was to reach out to some people who are dual credentialed already. So there were a handful of them actually, and we reached out to them and asked them their own experiences with regards, what they were doing. Are they more involved with research, with clinical care of their patients, academic or community setting? So basically, that's how it all started, and the rest is up to Ameya, who actually took the charge and is the first author of and he can talk more about the details.
All right, then I will direct this next question at you, Ameya. It was a survey study, and you, as you said, surveyed some attending level physicians and also some trainees. And what kind of questions did you ask them?
Thank you. So our questions were geared towards one, demographics, and secondly, towards what their current area of practice was. And then we asked them specifically about their exposure to sleep medicine during their training. So between PGY1's years 1 to 5, any clinical exposure to sleep medicine, either as a formalized, in a formal didactic fashion, or incidental, which is quite common. And a lot of people did mention that they had incidental exposure to patients with sleep issues, such as most commonly obstructive sleep apnea related to opioid related disorders, insomnia, restless leg syndrome. And so those were some of the questions we approached, discussed regarding their exposure. And then we went into whether they were interested and whether they thought they saw a future in this field for themselves as well as their trainees.
And what kind of responses did you get if you had to summarize? I guess let's talk about the subjects one at a time. So when we're talking about exposure to the field of the combination of anesthesia and sleep, what kind of things were people telling you?
So most people told us that they didn't have a formal exposure to sleep medicine the way anesthesia trainees are exposed to pain, chronic as well as acute pain, just for a comparison. But they did informally see patients with sleep medicine related issues in the perioperative setting, both in the setting of the OR, the operating room, as well as in their chronic pain rotations when they saw that patients presenting with chronic pain did have a lot of comorbid and insomnia related, sleep related issues, both comorbid too, as well as a consequence of chronic pain. So that's one thing that we really saw. And the other thing was that they did realize that they saw these in an increasing number of patients with sleep related issues in their allied postings, like non-OR postings, shall we say, or postings in allied specialties such as respirology, ENT, when they rotated either through clinical base here or off-site postings.
And so you mentioned, the combination between anesthesia and pain. So obviously when you're in an anesthesia fellowship, I didn't do one of those, to clarify, I'm PULM sleep, but I would presume that you guys are doing pain elective rotations and things like that. Is that true? And So how common is it to do a sleep elective? Is that even an option in an anesthesia training program? Did anyone talk about that? Does anyone, push that? Or is it part of the curriculum or not at all?
So I trained in India, and I'm currently doing fellowships in Canada. Um, from a resident's perspective in India, our exposure to sleep starts and ends with obstructive sleep apnea. That's literally it. There are other things that are mentioned, but that's if you ask someone about sleep in anesthesia, OSA is the elephant in the room. It's only when you dig further and you explore a bit more that you realize there's more in this setting. And in India, at least, there's no formal exposure to any sleep-related topics during anesthesia residency, other than the fact that you have didactics and clinical teaching related to sleep apnea, as well as opioid-related sleep disorders.
Do you want to answer that one too, Mandeep?
Yeah, of course. I agree with Ameya. I somehow it's very similar to what actually departments of anesthesia across North America and I guess across the world realized. Why would people, medical students, how would medical students decide to choose anesthesia as a choice of their residency? And one of the important factor that was identified was how soon do they do the anesthesia elective rotation during their clerkships, right? So for the programs, if they have a lot of clerks who are rotating in anesthesia after they have applied for their matching done, good luck. That they were never exposed to the field, right? So uh, definitely, the question is, are they actually, are the residency programs across North America or the world actually having a sleep elective? And how would a sleep elective look like? So we published a few years ago the Sleep Well curriculum that could be actually incorporated inside of anesthesiology literature, our books, our textbooks, and also our training programs which would include, not just the knowledge of sleep disordered breathing, but also, looking at sleep overall. So there are multiple domains of sleep health, how they would actually integrate with, say, for example, neurological outcomes, after people undergoing elective surgery, neurological outcomes after, if a surgery occurs late part of the night versus during the daytime, for example. How are people sleeping if they are actually undergoing ambulatory surgery versus in hospital surgery for the same operation? So those are some of those things. The other domain is looking at wellness of healthcare providers as anesthesiologists ourselves. Um, Expanding our knowledge base outside of sleep disordered breathing to, sleep related movement disorders, primary disorders of daytime hypersomnolence, such as narcolepsy or idiopathic hypersomnia, how they would relate to perioperative exposure to anesthetic agents. Now please feel free to include it in your actually reading material. That would be a good educational resource as well.
In reading your paper, it seemed to me like the exposure was the main issue because the things that you guys talked about in the discussion, lack of adequate mentorship and support, and just simply people being aware of the option to dual credential in anesthesia and sleep. I feel like all of those things stem from just not being exposed. Was that your conclusion?
So yes, exposure was the big finding that people just didn't have exposure to sleep medicine. But even amongst those who knew that sleep medicine was a potential fellowship opportunity or a career opportunity in the future, they found that lack of mentorship and support around it was one of the challenges that people identified in considering that sleep medicine could be part of their future. So exposure one, and even when exposure was there, a lack of mentorship, availability of information, availability of how do I approach this? And those were barriers that we identified.
Yeah, on top of that, there's also actually a lot of pathways available for people to take up, further training into sleep medicine. For example, the American Board of Sleep Medicine now accepts American Board of Anesthesiology residents, once they pass the boards, to actually apply for sleep fellowships across the country. We are also working with the Royal College of Physicians and Surgeons of Canada to have our Royal College Sleep Medicine AFC diploma to be open to anesthesiologists, so they could apply and train further and formally get these training certificates from the highest authority, in our countries. But there are also alternate pathways available, such as doing non-accredited fellowships, but at the same time logging in your experience and then registering with your local colleges in your states or in your provinces, and getting them basically signed off by those programs or by your supervisors, and therefore you could still apply for increased scope of practice in sleep medicine after being a specialist anesthesiologist.
One question I would have is, things are different in the United States. And is there anything that is being done as far as combined programs or anything else to make it easier to pursue a combined credentialing in anesthesia and sleep?
That's a great question. I think there's a lot of room for opportunity. To tell you the truth, I think it's still relatively unknown. I don't know that most residency programs give any special training or opportunity in sleep medicine. And my suspicion is that still most places, most program directors, just aren't aware of what the fellowship opportunities might be or what the training might look like. I think that in the majority of centers in the United States, sleep medicine and anesthesia and kind of the perioperative realm still remain somewhat separated. What I do think is good is that even though there aren't many of us who are dual credentialed, there are more. And it seems like every year there's a few more people from anesthesia who train in sleep medicine. And so the more those of us who are dual trained go out and practice, and we go to meetings and folks get jobs at different places, I think it slowly but surely increases the exposure and therefore increases the mentorship opportunities and the awareness. I do think, though, that this is an area where it's ripe for opportunity for us to really share with trainees the interesting and cool things that can be done with sleep medicine.
That is a perfect segue into the next thing that I wanted to talk to you guys about. What is anesthesia and sleep medicine? What is that intersection? And what do you love about it?
Gosh, what do I love about it? What I love is that it gives me as a clinician a lot of really neat variety with what I do. Anesthesia is so fun. I get to work with a lot of great colleagues. I get to take care of a lot of interesting patients and do interesting cases. It can be unpredictable. It can be stressful at times, but it's really fun. I think sleep medicine, the things that I find so rewarding about it, helping people sleep better, making a new diagnosis, helping them feel better, that's also really fun. The things that are stressful about both of my specialties are different. So it's kind of a nice balance of the things that maybe feel a little bit stressful and the things that feel rewarding. And I really believe that that will add to my longevity as a healthcare provider. One of the favorite things that I get to do is see patients referred to the sleep clinic by our bariatric surgery group. It's common, I think it's probably standard at all of our centers that patients are screened for sleep apnea if they're exploring bariatric surgery options. Many of those patients will have sleep apnea, and we may recommend treatment, before any type of surgical intervention. Some of the most rewarding patient encounters I've had are helping see people for a consult visit, getting them treated for sleep apnea. Then they might undergo some intervention for weight loss. They come back, say 6 or 9 months later, they're feeling great. They're really happy with the place that they're at with their weight loss journey. They're sleeping better. We might do a repeat sleep study, and it shows us that they no longer have sleep apnea. And that just feels really special to be part of that with patients, and to see on their faces, how happy they are, and how much better they're feeling. And that's a neat intersection of my two specialties that I'm very grateful for.
Those are great points, Sarah, and I agree with all of them. And to add, some of my reflections over the years, I find that both the fields we can be very hands-on, right? So in anesthesia, we're very hands-on. We love doing our procedures, IVs, outlines, invasive monitoring, taking care of the patients, and monitoring different physiological variables, through the case, throughout their journey. And similar to that, we practice the same in sleep medicine. So, when we are reviewing their sleep studies, it is post hoc analysis of all the physiological variables that were collected when the patients were sleeping. And it comes very naturally to us as we're scrolling through our sleep study data, the raw data. It's like looking at the OR monitor as we're monitoring our patients. So I find that quite similar. The hands-on nature I find is, now we see a lot of sleep variables coming up. So it's again very hands-on. We're playing around with them, and in our research programs in Ontario, for example, we are introducing different kinds of these, ETSATs, home sleep apnea testing monitors, to see what these roles may be, and also at the same time, find a place for in-lab sleep studies for our patients. So that's very exciting. And the knowledge, the pharmacology, for example, the knowledge that we have in the perioperative world, knowledge about anesthetic agents, muscle relaxants, pain medications, and how they would interact with other medications that the patients may be having for their cardiac conditions, respiratory conditions, immune conditions, cancer treatments. And then similar to that, we have sleep pharmacology, that has come up. And also what I felt, practicing sleep medicine, it gives me more, space and time to think about the patient as a whole, as we talk to the patient. So it gives us more time to actually understand them better. Sometimes we find that in the anesthesia clinic, there may be too many patients who are booked, and we have to get through the list. And at times, it may be felt that, hey, we don't get much time to speak to them. So with the sleep medicine perspective, I find that, that kind of a gap is now fulfilled. And we have better longitudinal follow-up with our patients. So if we initiate a treatment, as you mentioned, Sarah, we have the opportunity to follow up with them to see how they're doing, with any of the interventions or suggestions for their diagnostics or therapeutics that we have come about and planned their management plan. So that is what I really find, quite interesting.
Yeah, I agree completely with both viewpoints. Just to add to that, I think like what Mandeep said, in anesthesia we are very problem focused. We have a patient for a particular procedure. We are thinking about the patient, the comorbidities, that particular procedure. Whereas in sleep medicine, you get to see a patient more more in their usual environment, more holistically, if you will. And I find that extremely rewarding. Like, um, nobody should need to work to sleep, and it's especially rewarding when you see a patient and follow up and they're like, doc, I slept, I've never slept like this before. So that's this sort of feedback loop which is extremely rewarding to me, because in anesthesia we see a patient today, and if everything goes well we don't see them a couple of days later. So that's the sort of and it's very complementary, the skills are complementary. um like Sarah mentioned, the focus is slightly different, and
Right. I was hearing a
yeah,
lot of
it just
themes
makes
of
your week better, I feel.
balance between the two specialties, just having a lot of variety, having the opportunity to see patients in the acute setting, but also in the chronic setting when you're seeing sleep patients, and actually getting to follow them longitudinally and see them get better, which is something that you probably don't get to see a lot in anesthesia. And then also, you mentioned the perioperative evaluation. I would also imagine that the pharmacology aspect is probably a strong suit of you all, because there's a whole body of literature about impact of anesthesia and analgesia on the airway, and I would imagine that you guys are probably well versed in that as well. Are there any other areas that you feel like you really shine in, or any areas of research that you're really excited about, or any areas of practice that you guys really enjoy that we haven't talked about yet?
Yeah, that's a great question as well, Kara. So, at SASM, in our annual meetings, we have actually brought in workshops over the last many years where where the attendees will come and get an opportunity to see what's happening in both the fields. So, a few things that we have highlighted are, point of care ultrasound, for example, from the anesthesia world. We use point of care ultrasound, to do nerve blocks. We do point of care ultrasound to look at, the lung conditions or cardiac conditions, placing invasive monitoring, and helping facilitate those procedures. One of our mentors in our center was Vincent Chan, and he was everything ultrasound. So if there is a structure, you can ultrasound it. We got inspired, and we are developing the utility of point of care ultrasound, to diagnose people with moderate to severe obstructive sleep apnea, for example. There are also potential, applications in the OB setting or in the pediatric setting where there's less time for these patients to go in and get a lab sleep study done. And if they are coming in for an emergent procedure, for example, and we have to make decisions that are going to impact their clinical outcomes and their care, we can use point of care ultrasound machines that are available all around us to make that decision. Because as we know, using regular questionnaires, there's a chance of having increased false positives, and then we may end up actually unnecessary resource allocation for people who may not actually have obstructive sleep apnea. So that's one example. But our other workshops also include what we bring from the sleep medicine field. So we have the diagnostics workshops looking at all these new monitors coming up for not just for obstructive sleep apnea, but also for sleep monitoring. Sarah has led the therapeutics workshop station, and high flow nasal oxygen, for example, or positive airway pressure. Yourself, Kara, have been involved with those workshops as well, to talk about hands-on stuff, right? Okay, so what is auto CPAP? What is CPAP? What is BiPAP? Well, how we can help our patients? If patient is having these events, bring in the machine and just put it on in the PSU, right? And help them with those things, because our nature is very hands-on. So, and that's I think a good direction where both our fields can actually, come together.
Yeah, I love that. I think that's spot on. I think that the hands-on aspect of sleep medicine is really exciting, and also probably an area that's really relevant to this crossover of both the specialties. Did either of you, Ameya or Sarah, want to answer that question?
I think one thing I would add, and I agree with everything Mandeep has said and that Ameya has said, one particular area where I see a lot of opportunity for anesthesiologists with training in sleep medicine is in helping to best sort of triage for our patients where they will have the most success with surgery. And what I mean by that is who are our patients who are very well suited to have ambulatory surgery, perhaps in an ambulatory center or freestanding surgical center? Who of our patients are going to be best suited having their surgery in a hospital and maybe, needing some more monitoring, or they might need to stay overnight? I think that's a really complicated and challenging question as, there's more and more demand for procedures and surgeries and resources are limited. And as we know, patients are coming from often far away and may not have an opportunity for the preoperative evaluation or screening that might be optimal. And I sure wish I had the answer to all of these questions. I think it's a big challenge, but I think it's where individuals with our subspecialty training could really contribute a lot to help our patients, be set up for the most success. And I expect that need is going to continue to be there in the future. And so for any folks who listen to this who are considering sleep medicine as a subspecialty, I would really encourage them to think about how this type of training really can add a lot of strength to a person's sort of toolbox as an anesthesiologist.
Yeah, great points. The one thing I want to say is, in addition to this, we like at our clinic, we work very closely with our chronic pain colleagues, and we all know that chronic pain is pervasive. It affects every part of your life, and that includes sleep, your mood, altogether. And there's a bidirectional relationship between all of these, between mood, sleep, as well as chronic pain itself. So tackling each of these together actually results in better outcomes, we feel, and it's good for patient care. So that's one more place where I think anesthesiologists with sleep medicine training really have a chance
I
to
think I'll
excel
just
and
ask
carve a
one
niche out for
last
themselves.
question here. Before I do that, I want to take advantage of the fact that Mandeep brought up the workshops that we have at the Society of Anesthesia and Sleep Medicine National Meeting. That is coming up this year in October, on Friday, October 10th, and it's going to be held in San Antonio, Texas, which is a fantastic place to visit. And we will all be there, and you'll get to hang out with us and have a great time. So I would encourage anyone who is interested in anesthesia and or sleep medicine to attend. It's a really great meeting and lots of opportunity to, pick our brains and get some hands-on experience as well as fantastic didactics. So for my final question to you all, this paper came out in 2019. Do you think that things are getting better as far as the issues that you identified with exposure and mentorship and all of that? And what is your vision for the future?
I think it's sort of slowly but surely um, getting better in terms of more trainees being aware of sleep medicine as a subspecialty. And I think that's going to continue to happen. The more people who are aware, the more they can connect with folks like us who've trained in sleep medicine, the more everybody will sort of know somebody who's thought about it or trained in the subspecialty. And I think it will have kind of a snowball effect, or at least that's what I'm hopeful for. Um, and I know there's, trainees who've come through the sleep medicine fellowship in the past several years who are out in practice at other places in, the United States. And I think, again, that just is going to increase our exposure. And I'm really hopeful. What I would love for the future is that it's sort of a normal part of people's anesthesia residency that they at minimum, know about sleep medicine as a fellowship opportunity. But even beyond that, that folks have the opportunity to do an elective in sleep medicine, either with an anesthesiologist or with other sleep medicine providers at their institution. And perhaps that could include time in the perioperative clinic, thinking about sleep issues in that specific setting. So I'm hopeful that we can get there.
Thanks, Sarah. Yes, I agree. And there is a little bit more work to be done in Canada. So I did touch upon that briefly. Um, uh, the, we have reached out to the Royal College to actually, include anesthesiology as a qualifying specialty for the accredited sleep medicine diploma from the Royal College, and we have had some amazing conversations and very fruitful discussions moving forward, and they've acknowledged our interest. So hopefully we can have some official announcements to that regard. But at the same time, we are privileged and fortunate to be here at SASM to receive the interests of many potential trainees. And Sarah and I have been fortunate to be talking to those people, and quite a few of them have actually took up sleep medicine training in the U.S. And actually fortunate to have someone like Ameya here joining us for this session. And in our discussions, many times, I say, Ameya, you're the future, man. We are the past now. So we want more Ameyas and more, more people to come and join us and take this field forward, because we need the young minds, and this is what we are at SASM, to encourage our youngsters, our students, our residents to ask questions, and if it fits your short-term, long-term goals, this may be the path that you may want to live up to, right? And be that person with the dual credentials.
Yeah, agree with that completely. Unfortunately, I'm still in a minority in the sense that Canada still doesn't have a lot of anesthesia graduates who are training or considering training in sleep medicine. But I think that's changing. Like every person I speak to or somebody who's done a fellowship in sleep medicine speaks to does lead to an increase in knowledge about opportunities and potential career paths, and just some things are just interesting just to know. So I think that will translate down the years, and I think in the near future this we will have more people from anesthesia training, cross training in sleep medicine,
All right,
and
wonderful. Yeah, maybe the next
more
podcast
colleagues
we'll
for
have
this
10 people on
podcast.
here talking about this. Did you guys have any final things that you wanted to add? Anything that I didn't ask about that you think is important to mention?
So when are you doing your anesthesia fellowship, Kara?
Well, the thing
so
about
you can be a dual credential.
I have a different dual credential in pulmonary and sleep, and I might add that I've already done 6 years of post med school training. So I think that ship has sailed. I think that my husband would leave me, and my kids would disown me. And my dog would be very upset if I went back and did more training.
It can be triple credentialing.
Yeah, right. I don't think I need any more. I'm good with the credentials that I have. But I really appreciate talking to all of you guys. It's really cool because, I find a very interesting intersection of pulmonary and sleep medicine with the sleep-related breathing disorders and non-invasive ventilation, and, managing people who have COPD and sleep issues. And so I love hearing about this intersection that you guys find and appreciate between anesthesia and sleep medicine. I think it's really interesting and exciting, and I don't know why more people don't do it. It's not even as long as PCCM plus sleep. It's really a better way to go, actually, when you think about it.
I hope that for everyone who listens to this, if you're a trainee, don't be afraid to ask your residency director or people you know to pursue an elective in sleep medicine or get in contact with us here at SASM. It's a really neat career pathway. And I know all of us are excited about, as Mandeep said, kind of the next generation of folks who are going to explore this opportunity. And we're happy. We love talking with people who have interest in sleep medicine and answering questions and talking about what drew us to the field and what our practice is actually like. So come to our meeting in the fall and, join SASM, and don't hesitate to reach out to us.
Yeah, and our names are all over the SASM website, and so we are easily reachable. And you can also send an email to social@sasmhq.org, and I will see it and get you to an anesthesia sleep dual credentialed person if you have any additional questions or if you need a mentor. I'm offering you guys, but I know that you are all the people here today are very willing to share their knowledge and expertise and mentorship with people who are interested in the field. So don't be afraid to reach out. All right. Well, thank you guys so much for taking all this time today to talk to everybody about dual credentialing in anesthesia and sleep medicine. Great discussion.
Thanks for having us.
Thanks for having us. Thanks for leading this.
Thank you so much.